Many people suffering from acne don't realize that one small difference in the application and use of medications could make or break their acne treatment. In this video, I'll be covering the best way to use medications for acne on the face, explain exactly why this method works and is the best cost-effective method for you, and what methods of application should you stay away from to avoid side effects and potential exacerbation of your acne. Before we get started, don't forget to smash that subscribe button. Also, don't forget to share and like this video. Now let's get going. So topical medication treatment of acne makes up the lion's share of acne treatments out there. This is what most people get. And interestingly enough, most people do not know how to properly apply medications to the face to treat acne or other conditions for that matter. So there are several considerations to applying acne medications to the face. First of all, those medications need to shut down acne production underneath the surface of the skin. That means that you're not seeing what you're about to treat on an individual pimple level, but you're actually treating the entire factory, if you will, of acne underneath the surface of the skin. That means you're treating blind. And as blind treatments go, you need to apply the medication all over the face, not spot treatments. Spot treatment can actually wind up irritating the individual pimples that you're applying medications to and actually prevent you from treating the production of acne underneath the surface of the skin. So that can wind up as a double whammy for you, irritating the pimple that you're trying to clear up, which is already clearing up on its own, and also failing to address acne underneath the surface of the skin that will keep coming up to the surface of the skin as new crops of acne. The other consideration is that many medications that are used to treat acne can potentially dry and irritate the skin. That means that, again, you want to spread the medication as far and wide as possible over the treatment area, and you want to use the smallest amount possible to gain the effects that you're looking for. Those two considerations on their own dictate the way you're going to apply any medication to treat acne on the face. That means that you need to use a pea-sized amount of the medication on your index finger. You're going to apply it over the entire face rather than spot treat, and you're going to make sure that it's evenly applied over the entire face to avoid irritation and address acne anywhere on the problem area, which is usually the entire face. So what do? You squeeze out a pea-sized amount of the medication on your index finger. You dab it on four corners of the face, the forehead, the cheek, the other cheek, and the chin. And then you're going to spread it all over the forehead, cheek to nose, and chin. And then you're going to do another pass. You're going to make another pass to make sure that the medication is evenly applied over the entire face. Again, a single pea-sized amount of the medication, whether it's the retinoid that you're using, tretinoin, adapalene, dasaretine, any other retinoid, or even clindamycin, benzoyl peroxide, or other medications that you choose to apply to the face, the method of application should remain exactly the same. You're going to use a single pea-sized amount, not two, not three, not four, a single pea-sized amount of the medication on your index finger. You're going to dab it on the middle of the forehead, cheek, and chin, and then you're going to spread it all over the forehead, cheek to nose, and chin, and then you're going to make another pass to make sure that the medication is evenly applied over the entire face. You are not going to use any more than a single pea-sized amount. Any more than that can potentially get you dried up and irritated and will not get you any additional benefit as far as the efficacy of the medication to treat the acne. So you want to use a single pea-sized amount, not two, not three, not four, not any more than that. The other thing which I've mentioned earlier, you will not spot treat acne. Not many people realize that the acne on the surface of the skin are as good as gone. They cycle through and the skin just sheds itself and the pimples resolve in due time. So the best thing you can do for pimples on the surface of the skin is mostly to leave them alone unless there are special circumstances and the individual pimple is very irritated or inflamed, in which case you can actually apply a little bit of petroleum jelly to take the edge off, protect that area from further irritation. And if the pimple is exceptionally irritated, maybe even painful, you can always go to the dermatologist's office and get that individual pimple injected with corticosteroids to bring down that individual pimple. However, any other spot treatment that you may apply to a pimple on the face is usually going to fail, especially when you're using a medication that's designed to be applied over the entire face evenly. Medications such as retinoids can actually drive that pimple up to the point where it gets more irritated and more inflamed, making it last longer and potentially resolve with further discoloration on the skin that'll last even longer than that. So your best approach would be to avoid spot treatment of pimples. Certainly don't squeeze them or try to pop them. That will again inflame the pimples further through physical manipulation and abrasion. So don't do that. Avoid manipulating or treating individual pimples. For acne treatment, again, your approach should be use the smallest amount of the medication, spreading it as diffusely as you can just to cover the entire area to treat blindly, thus shutting down production of acne over the entire problem area, avoiding the side effects, and then getting through to the endpoint where your acne is finally in remission. If you've enjoyed this video, don't forget to smash that subscribe button. Also, don't forget to share and like this video. Thanks for watching. God bless.